What's up, y'all? It's kind of... Let me get that for you real quick. Seems like it's a little loud. There you go. All right, what's up, y'all? I'm a little kind of frustrated. When am I not, right? All right, so let's talk a little bit about this. This came up in conversation recently, and I wanted to talk about a medication or an injection being used to treat, especially the fact that it's being used in children. Now, I will say this, I understand that watching a loved one suffer, whether it be with migraines or anything else, watching someone suffer with pain is, it's heart-wrenching, it's devastating. Migraines can be devastating to the individual who's suffering with them, for sure. My wife used to deal with severe migraine headaches until some great friends of mine, some chiropractors in Nashville, Tennessee, give a little shout out and to the Kessner Family Chiropractic and Kessner Health and Wellness down there in Nashville, Tennessee. They're on the west side of Nashville. So great chiropractors who want some very specific structural corrective care. And I've got some other friends spread out throughout Nashville if you need some great chiropractic care. But they helped her with her migraine headaches substantially. And then now with integrating some other things that we're doing as far as wellness way care goes, eliminating food allergies, staying away from dairy and things like that she's allergic to, has greatly and vastly further improved her inflammatory responses or helped her body downregulate those inflammatory responses that can trigger her migraine headaches. Along with that, what we'll be doing with my wife, since I'm on that topic, we're actually finally scheduled a explant for her. This is not of my doing. This was not one of my encouragements, and this isn't where I married my wife. I love my wife, and so getting an explant is something I strongly encourage if you or a loved one has had breast implants and is dealing with implant illness. It's known to cause chronic fatigue syndrome. Autoantibodies to the silicone can upregulate the immune response, causing chronic inflammation, weakening your entire system, and causing a lot of problems. So, that said, you can see that there's a difference now as I transition here. You'll be able to see that there's a difference between the way I think, the way Wellness Way thinks, the way chiropractors think in our treatment of the individual dealing with migraine headaches. So what came up in conversation was the use of CGRP inhibitors, basically monoclonal antibodies used to inhibit basically the proper use and function of a enzyme and transmitter in your brain and nervous system that ultimately signals for can trigger pain signals. All right, so basically they turn your immune system against a normal, healthy, proper, needed transmitter. So FDA approves drug to prevent the migraines without side effect. That is a lie, flat out lie. All right, so the blocking of this, the block calcitonin gene related peptide, all right, they block that, they basically turn your immune system against it, and that calcitonin gene related peptide is needed for signaling of pain, but not only that, it's also needed for vasodilation, and especially in critical situations such as an ischemic attack, a fancy dancy term for stroke. So if you're having decreased blood flow to an area of your brain, your body will release that to enable you to dilate your blood vessels to save your life or save your brain. So it's pretty important that you don't block that completely. Very short-term studies have been done on these drugs, these inhibitors. Yes, they do help individuals with the pain that they're suffering from migraines. Migraine headaches alone themselves increase the risk of stroke and cardiovascular mortality and risk, especially in elderly. In the 40s, 50-year age range, it starts to go up. Migraines are sinus systemic inflammation, full body inflammation. They are caused by neurogenic inflammatory responses primarily. As chiropractors, we take care of a ton of people with dealing with migraines. it is one of those things where I can tell people dealing with migraines, and especially children dealing with migraines, I can tell the parents confidently that it is upwards well above 90% of the individuals that I've treated for migraines. Chiropractically, I have seen a complete resolution or substantial decrease with chiropractic alone. Now, the other aspects of reducing inflammation, working on gut health, and the elimination of food allergies has helped another percentage, and ones that have not found a complete resolution or the resolve of migraines. So food allergies would be the next step that I would say have massive improvements. And again, like I discussed, my wife's situation, removing her breast implants will enable us to remove another trigger of an inflammatory immune response, thus allowing her to heal at a greater capacity. So hopefully then we'll have complete resolution of her migraine headaches. But here's what got me kind of ticked off. Let me read this to you about this drug. Actually, first, before I read you that, let me read you about the wiping out CGRP, potential cardiovascular risks. It says, besides its role in the pathophysiology of migraine, CGRP, this peptide, may act as a vasodilator, safeguarding during cerebral cardiac ischemia. So cerebral, brain, cardiac, your heart. So decreased blood flow to your heart or your brain. It's kind of important you get blood flow and oxygen there, and if you don't, you could die. Or you could be brain damaged for the rest of your life. So this is not a method that I would choose personally. Again, I cannot choose for those individuals that have suffered with pain for a very long time. But I just look at this. The concern arises that CGRP blockade, a mild and usually transient ischemic events, mild ischemic, reduced blood flow, circulation to your brain or your heart. These mild events that many people go through throughout their lifetime, even at younger ages, might be transformed into full-blown infarcts. What does that mean? Full-blown strokes and heart attacks in individuals on this treatment. So again, I understand migraines are completely disabling at times, debilitating. They wreak havoc on a person's life. But I'm telling you, please, please, please do not go to such a treatment as this until you have fully exhausted the means of proper chiropractic, structural correction, and upper cervical specific. Most of the time, if I've seen somebody go under that have been through chiropractic care and then ultimately seek care in my office, what I find is being more specific with the upper cervical spine, the atlas rotation component, adding that in, we see a substantial further improvement in their migraine or resolution of their migraines or reduction in the severity, intensity, and frequency of migraines. That being said, so now you have a treatment that messes with your immune system, messes with your neurotransmitters, and not only that, doesn't correct the cause. So you need the drug for a really long time, basically probably the rest of your life until you take care of the cause, or it just haphazard, somehow you correct the cause through lifestyle changes or others. So listen to me here. Going back to this article about this drug that said there was no side effects. Yeah, right. Drug company saying, hey, we did our studies, there was no side effects. You lied in the past, you lie again, I'm sure. We'll find out later for sure that there's massive risks to this medication. So the drug maker Amgen setting U.S. list price is for this once a month self-injection treatment will cost $575 per month. That's $6,900 a year, all right? So what I'm putting out here right now is an announcement for all those individuals who have suffered with migraines in the past that I have treated, and you have found resolution, and you continue on to this day. You know, I've got one lady that started back in 2010, I believe it was, or 2011. One of my very first patients, she had migraines, dealt with them for like 20 years. She basically doesn't deal with migraines anymore. She's done that for 10 years. So I need to get a back payment on, I've been charging you way, not enough. But again, you heal under chiropractic care. If the primary problem, the neurogenic inflammation, remember that the release of this peptide can be caused by neurogenic inflammation, neurogenic excitation because the mechanics of your upper cervical spine are off. You have misalignments up there. So what I would say is if you're dealing with migraines and we were able to resolve them under my care, please back pay me. I'll actually give you a discount. We'll go $575 a month, $6,900, just flat rate, $6,000 a year. So everybody, $6,000 a year if you found resolution in your migraine headaches. I mean, shoot, I believe this girl was like 6 years old, 22-day straight migraine headache. We did it phenomenal. It was awesome. The parents were great. The little girl was great with us. They did a testimony on her, what medication is $575. Jackie says it's a drug by Amgen, Aimovig, Aimovig. And people be like, well, insurance pays for that, doesn't pay for chiropractic therapy. Yeah, we need to push for insurances not to be feeding big pharma. But yeah, I mean, that's just nuts to me. Medicine doesn't heal you. They increase your risk of stroke and cardiac problems later in life. Meanwhile, taking money, and listen to this, the price of the drug reflects the value it brings to patients and society, including the financial impact on sufferers, caregivers, and employers, while also factoring in other things like affordability. How many of you can afford $575 per month? How many of you can afford $6,900 for each individual in your family who deals with migraines? All right? They don't care about you. This is the corruption of medicine. This is a perfect example of taking advantage of somebody who's in a suffering state. All right? Whatever may have been the cause, we'll simplify bad luck. All right? If we take and we correct the cause, they heal. All right? That little girl, 6 years old, it's been like 3 years, I think now. No migraines. After a series of a few adjustments, no more migraines. And that happens all the time in chiropractic offices around the globe. But we don't step back and say, you know what? So you're here for migraines. So what I'm going to do is I'm going to factor in the value of what my care is going to provide to you or your child. So your child's 6 years old right now. So let's get a calculator out here real quick, actually. We'll just do it, Let's look at this. So your daughter would be 6 years old right now. Let's say that she lives the average age. Let's just cut off around 70. So let's go with around, she's going to live for another 65 years, okay? 65 years times $6,000. All right, so $390,000, all right? So I'm gonna correct your child's alignment of their upper cervical spine. She'll have complete resolution of the migraines. Because of the value that I'm gonna add to her life, that's almost $400,000. If you wanna prepay for that, go ahead and do so. Again, the reason chiropractors can't do that is because once you've healed, I have patients with Crohn's disease. I mentioned this because I have multiple different autoimmune patients. I have multiple different migraine suffering patients, chronic back pain patients. We have people that I've seen little children with eczema and allergies. And again, some of these illnesses are multifaceted. Some of them I've seen that they've resolved. I've seen, posted a photo here on Monday, I think it was yesterday, about a patient, Constance, who, guess what? She has 3 little boys right now, okay? What's the average in vitro fertilization treatment? I don't know, $20,000, $30,000. So guess what? She owes me 90 grand, okay? 90 grand, we'll go with that. Wait, I'll give her a discount. We'll go $75,000 for her 3 children because she has scoliosis over her lumbar spine, interfering with nerve transmission going to her reproductive organs, and all it took was correcting and improving the biomechanics of her lumbar spine, allowing for better nerve supply, basically better communication, and from the brain to the reproductive system, and her husband were able to have 3 little boys. All right, so guess what? Should I charge her the value? Because that's what drug companies want to do. They want to charge you the value of what they're going to do. But they're not going to correct it. You're going to just need to keep taking their injection monthly until you have a stroke or heart attack because of their drug. And then you die early. So you could live till you're 50 die of a stroke because you took the drug every single month from 10, 12, a teenager. So you lived with less migraines, less frequency, less intensity of migraines, paying them $7,000 a year. Got to include the doctor's visits. They're going to charge a bit for that too because they got to prescribe the drugs. So everybody's making money on you, not healing you. Then you wind up with the side effects. And if you live through the stroke, now you need assisted living. Now that's going to pay them a lot more money there. You see how messed up this system is? It's like the value we're going to give you is so great. Yeah, we're not going to make it affordable for you. We're going to say basically either pay us or go on with life suffering. Most people, they'll pay or do anything to get out of pain. But I'm glad I'm one of those chiropractors. They're not going to sit back and be like, listen, I'm going to charge you what my value is. My value is at least as much as that right there. But once you're healed, you don't need me anymore. To in a sense of treating you for that symptom and condition. Now, I am one of those crazy chiropractors. I recommend people get adjusted for the rest of their life. I recommend people exercise the rest of their life. I recommend people eat right the rest of their life, even after they've lost the 30 pounds. I don't care. I think you should stay healthy the rest of your life. You know what? I brush my teeth once a week, whether I need it or not, because some dang crazy dentist along the way convinced me that brushing my teeth could help me prevent cavities. So, I'm going to do it. I'm going to do it once a week. I don't care if I need it or not. I ain't going to wait till I have a cavity to brush my teeth. So when you look at your health, you need to maintain it. But anyways, that's what I wanted to rant. It was just kind of like sitting there. I'm like, this is ridiculous. If I was a drug salesman, I could charge people $6,000 a year, $575 a month for the rest of their life. Because I don't heal them, I deal to them. Man, I took up the wrong business if I wanted just money. All right, love y'all, appreciate y'all. I'm gonna look at some of the comments real quick, then I'm gonna jump off here. Risk absolutely outweigh the benefits. I am trying to get my grandma off her 15 meds. Slowly but surely she is learning. Awesome, change your life, take care of the underlying causes. You don't need those drugs, that's the goal. Thanks for sharing. We'll share with other migraine people. Awesome, Susan. I appreciate that very much. Again, I did jump on, and what was cool, and I'll give you this. So in the meantime, please seek the cause. I don't want to be like another functional med doc person, and I say that specifically because I see a lot of people, and functional med is better than just drugs. I believe that supplements and nutrition and herbs are better than just taking a drug to treat a symptom. But I did find an article, it's impact of food components on in vitro calcitonin gene-related peptide secretion. So that peptide that is inhibited by the drug, creating an immune dysregulation problem, basically creating an immune system antibody response to inhibit that peptide. It goes on mechanisms for dietary influences. One of the dietary influences that had strong effect was actually ginger extract, all right? Ginger extract is something I carry. If you want some, grab some, all right? But here's the reality. That is only to be used temporarily until you correct the underlying cause. Because still, again, I'm going to say this. If you don't seek the best opportunity, the best you can to correct an underlying cause of a health condition, you leave that condition to smolder, to get worse, and cause other problems in the future. Even if you're taking something that's going to reduce your stroke risk, ginger root is a natural anti-inflammatory, lowers inflammation, can help with many different digestive problems. It can lower this peptide, lower the secretion of this peptide, and it's one of the herbs that's well established to help people with migraines, headaches, joint inflammation, digestive system problems, and other things. But I'm not gonna sit here and just say, instead of the drug, here's a supplement. All right, that's not the way I work. That's not the way I recommend. All right, that's not the way I do it. My buddy Dr. Patrick would promote it. We want to promote to you the ability to discover and figure out the underlying factors and causes. And if you correct that, you get the best opportunity to be as healthy as you possibly can for the rest of your life. And that is my goal for every single one of my patients, all right? But in the meantime, if you need something right now to try and help you because you are suffering, man, I would be going after things like ginger root, turmeric, hemp oil, CBD, and others. Help calm that inflammation down, help calm down that type of stress response that releases that peptide that can increase the vascular inflammation. If you do that, guess what? You could have some improvements in your symptomatology, the symptomatic expression and appearance of your migraines. That would be awesome until you correct the cause. Use things like that to help you until you correct the cause. Get rid of the stressors in your life, the factors that drive a health problem, and then you're going to get the best results you can get. All right? Wish I had a doc like you near me. That's you. Diana, I appreciate you saying that. Thanks for the encouragement. We do consult by phone if you want help. Thank you for all your comments. I suffer with a huge back head pain since last week. Cannot cope with it. Could that be from my back, neck, which is all damaged? Yes, likely it is. One of the primary problems in tension type headaches is you lost the curvature, creating tension in the spinal cord, the nerves, and the muscles in the back of the spine. That is the most common cause of tension headaches. The reason they cause it tension headaches is because there's tension in the spine that causes inflammation in the back of the skull. Can also create tension on the suboccipital nerves and recurrent nerves that control vasodilation into the skull and around the brain. So blood vessel, and then those irritation of those recurrent nerves from atlas twisting, atlas misalignments can cause neurogenic inflammation that releases that peptide that then ultimately leads to the severe pain of a migraine headache. So yeah, they recommend Botox. Yeah, yeah. Susan, another one I know, took tamoxifen for years and suffered migraines, then recommended Botox to reduce migraines. You can't make this stuff up, tamoxifen. Yeah, a drug for breast cancer. So if you want to know, guess what's a great herb? Now again, I'm not saying get off your tamoxifen, take passion flower. But guess what is a slight aromatase inhibitor? Aromatase inhibitor, basically one of the best tests we utilize for hormonal dysregulation or hormonal problems in women, in cyclical women. We do a test called the Dutch test. We can actually look and evaluate pathways that are such as taking testosterone, androgen, and there's androstenedione. Anyways, testosterone over to estrogen. Guess what? If you see low testosterone, you see high estrogens, you could take passion flower as a light aromatase inhibitor, and there's other herbs that work this way as well, and they can actually block that in allowing for the conservation of testosterone and not the excess generation of estrogen, in helping to balance out. But again, you want to figure out what are the inflammatory reasons that are typically going to drive a hormonal imbalance. Figure that out. Or what are the deficiencies that are causing the hormonal imbalance? Or what are the stressors that are causing the hormonal imbalance? But you mentioned tamoxifen, so it made me think, I'll throw that out there for just, hey, play with it, great information, cool stuff. Jackie, I used to be duped by the Pharma's fake cures. Now I look for pharmacy with an F and natural cures to what affects us and our family. Awesome. So I suffer from hemiplegic migraines. I'm so happy you are talking about this. Awesome, Ashley. Hopefully this information helps you. I'm telling you that yes, chiropractic care and adjustment can mobilize the spine, increase and improve biomechanics. I prefer and went through additional training beyond my schooling to get my degree. I went into structural correction, even went through some Clear Institute training for scoliosis correction and improvements, and then did additional classes and courses through and basically seminars and trainings to look at the upper cervical spine more specific. And that upper cervical specific care is what I see having some of the best results in helping individuals resolve their migraine headaches. So, Shauna, I refuse to take tamoxifen. The most toxic thing right now is the toxic implants they put in because my mastectomy had to be done during COVID restrictions. Not I can't get them out, even though I already have autoimmune symptoms until September. Dang. Yeah. What's really cool, I'm looking forward to this. I feel, you know what, as I help my wife and we venture down the road of having her go through the explant, we're working with a doctor up in Cleveland, Ohio, and this woman, I forget the doctor's name, but she's up in Cleveland, Ohio. She only does explants. She does not do implants. She won't even put them in because she knows the harms that implants can cause. If you want some additional great information on it, not that this is a vaccine related topic, but it is an autoimmune topic, this book, all right? This book right here has an entire section on breast implant illness and how the science has really been watered down, just like the vaccine science has been watered down to conceal harms that vaccines cause. The science has been watered down by industry to say that breast implants don't cause illnesses and autoimmune conditions and chronic fatigue and things like that. But so this woman, this doctor that we are going to be going to, my wife will be having her explant done with, also does an herbalism type approach to detoxifying the body. So I'm super excited that she specializes in explant, that I'm going to be able to learn from, you know, my wife's experience. I'm going to be able to learn how to help more of my patients, because I sit there and have consults with patients, and if they have implants, I'm addressing that as a potential cause of their autoimmune condition, their infertility, their inflammatory problems, their joint problems, ultimately their connective tissue problems. Man, the list could go on and on and on, okay? So the chronic fatigue, bunches of things. Because again, the immune system is one of the primary systems of your body, like your nervous system. Those two systems, man, if you can heal and regulate your nervous system and your immune system properly, guess what? You heal a lot of things. Hormonally, you can heal far better. You can actually resolve a lot of hormonal problems, infertility issues, if you get to the sources of why the immune system or the nervous system is not functioning properly. So I'm just excited because that's going to enable me to help more of my patients and clients that are dealing with breast implant illness, because I'm going to be able to be more specific as I'll be able to learn from this doctor who's going to be taking my wife through explant removal of implants, encapsulated removal, and then a detoxification. So I look forward to learning about that, and I'll be sharing all that information along the way with you all. So, Jennifer, I need advice for getting proper care during perimenopause. I am having awful body pain and I am plummeting into a depression of sorts. I also fight Lyme. I'm using the Rife to treat. However, since all of this COVID stuff broke out, I feel like I am back at square one. All right, so we need to do, what I would suggest first is an immune panel on you to look at your CD8, CD4, and your natural killer cell counts, your ratios there. Looking at that, looking at your eosinophilic responses, looking at the numbers on eosinophils, your monocytes, your lymphocytes, everything. If we can see and evaluate that, we know how to properly support you with the proper herbs that can affect those different categories of cells, those different immune cells. Really, when it comes down to like Lyme, I have seen a vast, number improve with chiropractic care alone, because it does reduce the stress that inhibits your nervous system, capability of coordinating your immune system and down-regulating inflammation and enabling your body to be able to recognize your brain is your central command system. Your communication lines are through your spine and through your nerves that ultimately will be able to allow your body to know that that's your tissue, don't harm it, and you need to be able to properly signal and trigger the immune system in the region of the body where Lyme is hit so that you can properly clear it or keep it at bay. Beyond that then, when you look at going through this hormonal time period, this change, there are ways to support your body. I would say liver health has some of the biggest foundational effect on overall hormonal health and even immune health. If your liver does not function properly, you will not be able to metabolize, remove, break down, convert hormones. You will not be able to detoxify. You will not be able to remove inflammatory byproducts throughout the bloodstream, thus building up in your tissues and causing a lot more problems. So, it's multifaceted there. There's not one single silver bullet, but if you do want help, I would love to have the opportunity to try and help you. If you want a consultation, you can call my office, 931-591-2010, or go through thewilddoc.com, thewilddoc.com. There is a drop-down bar menu tab, and you can go and select for a consultation there. Shanna. And sadly, most plastic surgeons do not realize that their own patients have any issues because they end up going to a different doctor for their explant. My surgeon fully believes that the only chemical in the shell is silicone dioxide, even though there are 40 different chemicals in the shell alone. Yep. Sadly, patients know more than doctors about the material and the implants, that the doctors are implanting the material into the woman, and yet the woman who deals with the health problem because of the implant knows more about the implant than the doctor does. That's pretty sad, but that's the reality of medicine. Medical doctors are not trained well. They're trained how to do something, not how to properly treat an individual and understand why a health problem is there. They're not trained on that. They're a technician. They're drug dealers and they're surgeons. Now, some of these surgeons can save a life in a very needed time, all right? Thank God for the hands of a skilled surgeon that can save a life or help an individual or save a baby with a heart defect and other things. So I'm not downplaying the significant potential benefit from medical physicians when they have a better understanding and they do the right thing. So Lynette Marie Barron, appreciate you being on. Looking forward to Friday's discussion on Freedom Radio. I forget, tag it, Lynette, please. Put it on there. Everybody else look for the tag and the post by Lynette Marie Barron. Me and her are going to be chatting about this whole corona situation. So I love you all. Appreciate you all. I got to get off here real quick and head on home to my family. All right? Love you. See ya. Share the truth. Don't just like it. It's the only way we save lives.